streaming live, YouTube Live, WOCA, The Source Radio. As we're moving on with our Monday show, as we bring it to you here, Dr. Donna Cryer, who's the founder and CEO of the Global Liver Institute, or GLI, the only patient-driven liver health nonprofit operating in the United States and Europe, as we got her on the phone this morning. Good morning, doctor.
I only play a doctor on the radio. So I am actually an attorney by training, but I am a liver patient and transplant recipient.
Oh, wow. Oh, wow. So you, this time it's personal. Absolutely. This is something near and dear to your heart then, as what you're working on for your day-to-day.
It is. It absolutely is.
Now, it says here that when it comes to getting such as a diagnosis, biopsies, as the idea is biopsies can be scary, painful, can cost the patient. They are quite invasive and require a very interesting period for recovery, as biopsies can also be expensive and even risky, and especially in the case of a liver biopsy. And then somebody who has gone through it like yourself, you're here to talk a little bit about how, you can still recommend these, but tell people that that there's more to erring on a safe side here, and it doesn't have to be so scary.
Absolutely. So, I have had 6 liver biopsies myself. So I can speak from that experience,
Wow.
As well as now working in this field, for the 25 years since my transplant, and talking to a lot of patients and physicians along the way. So a liver biopsy, which has been the traditional method of understanding what's going on with your liver, entails taking a very large needle and in the traditional method, sort of just going in between your ribs and sort of chunk taking out a section of your liver to study that tissue sample. For the doctor, they're like, well, it's only a few minutes. But for the patient, it's really the whole day, because you have to then, you prepared before, and then you have to lay on your side to not bleed out because there's so much vascularization in the liver. And so if you're sitting there for, 1 to 6 hours trying not to bleed out or die, you have a lot of time to contemplate, couldn't we do better? And we can today with non-invasive diagnostics. And when you think about, a quarter to a third of Americans having some form of liver disease, and diseases like fatty liver disease and NASH growing with the rates of type 2 diabetes and obesity, we can't do a liver biopsy, even if it was a good idea, which it isn't. But we couldn't do a liver biopsy in the millions of people that we now know need to be diagnosed for some type of liver disease. Because of all the, the expense and, the radiologists, the hepatologists, the clinics. It's, so for reasons of, patient safety, of saving time, saving expense, alternatives to liver biopsy are really, really important.
Yeah, absolutely. And what are some of these alternatives that are available here to patients nowadays?
So alternatives to liver biopsy fall into 2 buckets, and they're, the general term is sort of non-invasive diagnostics, but they're basically blood tests or imaging tests. And for the blood tests, for most people who get blood work at their annual physical, they and their doctors often ignore the liver enzymes or liver function tests that are already there. They have it's sort of an alphabet soup, of course, in the lab work, ALT or AST, and there may be a ratio of them. And so scientists are now sort of combining them and calculating them to give a better sense of your the risk for or the presence of fatty liver disease and NASH. And so you may hear a doctor say things like a FIB-4 test or a NAFLD fibrosis score. But it's really just a different way of looking at the blood work that you're already having.
Mm-hmm.
And then the imaging tests are also based on things that are available or, are familiar to most people. So an MRI-based test like liver multiscan or an ultrasound-based test like a FibroScan, those are the major types of non-invasive tests. And when you combine that with, what's your history? Are you carrying excess weight? Do you have type 2 diabetes? What's your age and gender? You rule out other types of liver disease like viral hepatitis or autoimmune hepatitis, and you take these, you get either the blood or the imaging test in a much shorter time span for much less expense, without the risk. You can get as much or more information than a liver biopsy, and that's what patients really need.
Yeah, absolutely, and that's kind of why you're here to talk about that a little bit, is to make people aware that there's other options out there from what we're assuming are, like you said, a little bit scary and a little bit painful from the in a sense the other way, and that there is some other choices out there.
Absolutely, and your family doctor or your primary care doctor, they have a long list of things to look at. And I give them so much credit. My husband's a physician, his son's a physician, daughter's a doctor of veterinary medicine. So this isn't, I recognize that doctors are really overworked and have this long list of things to do. So they may not know about these new ways of diagnosing NASH. So a patient can just ask, what is my risk for liver disease? What's my risk for NASH with these risk factors? And, they may already have, depending on their clinic or hospital, they may have one of these calculators, built into their EHR, into their medical record, and not even know it. But if a patient just asks, is there, a non-invasive way to help me understand, my liver health, or to diagnose possible liver disease, we will have moved, so many people to a healthier state, and so I'm really excited that we've launched this Beyond the Biopsy campaign and can let people know about the choices and the control that they can have over their own health in partnership with their physicians.
And I think that's interesting too, when you mentioned the control over your own health, knowing that there's some other options out there. You're even kind of telling folks, if you thought about have you questioned anything with some of your pre-existing conditions or some of the medications that you've been on for years, that there may be something you should kind of think about when it comes to your liver, and you don't necessarily need to have, like we said, these scary, painful processes, that there's actually better ways. And with that in mind, like you said, it gives them a leg up on actually being a little bit more attentive to certain things with their own body, knowing that they can get tested and not be so much, and then at the same time that can keep them healthier there because they have a little bit more of the knowledge of what's going on with their own body.
Absolutely. If you have a liver, which is everyone, you are at risk for some type of liver disease. And so we want people to think about their liver health in the same way they do their heart health and their brain health, and a lot of the same things that you can do to keep the rest of you healthy can keep your liver healthy. But if you don't know, then you can't do something about it. And we want people to know that there are really easy things that they and their doctors can do to give them more information about their liver health and their liver function, while there's still time to do something about it before they, end up with a transplant like me.
Mm-hmm, mm-hmm. Now, where can people educate themselves about their options?
So at the Global Liver Institute website, we have information on alternatives to liver biopsy at globalliver.org/beyond.
Excellent, excellent. As we appreciate the time and a lot of good information there, and like we said, somebody who's got on the personal level that you had, and just incredible. And thank you for taking the time with us. As we mentioned, Donna Cryer, the founder and CEO of Global Liver Institute, and remember, the only patient-driven liver health non-profit operating in the United States and Europe. Thank you for your time. We appreciate it so much.
Thank you.
Got it. More AM Ocala Live coming your way. We'll be back right after this.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Ugh, what wrong?
Need wood for fire.
I go get. I got wood for fire.